Hi there, it's Dr. Davis again. And what exactly is irritable bowel syndrome? I'm sure you know the feeling, even though you may not know the name. Irritable bowel syndrome, or spastic colon, is one of the most common intestinal disorders. Most doctors and patients find it hard to clearly define just what irritable bowel syndrome is. It used to be a diagnosis of exclusion, where the doctor would finally label your symptoms as IBS when they couldn't think of anything else to call it. But IBS research has advanced so much in the last 5 years that it has cleared the path to a much fuller understanding of the cause and effects of IBS. This syndrome, or collection of symptoms, may start with indigestion, bloating, gas, and abnormal bowel frequency, and then progress to abdominal pain, cramping, heartburn, diarrhea alternating with constipation, and nausea. In addition, many patients have what are called extra-intestinal symptoms that are outside the digestive tract, like fatigue, fibromyalgia, urinary frequency, brain fog, skin conditions, and headache. Unfortunately, people tend to travel a disheartening journey starting with over-the-counter medications and then turn to their doctor for stronger drugs, and then possibly the gastroenterologist for a colonoscopy and barium enemas. Along the way, they may have realized that some foods increase their symptoms, and so tried limiting their diet so much that they're afraid to eat. And in the end, sadly, they continue to suffer and may even be on antidepressants. IBS is a problem in 3 fundamental areas: bacterial imbalance, neurology, and inflammation without the outward signs of the more aggressive gut diseases like inflammatory bowel disease, or IBD, or Crohn's disease. It can be considered a functional disorder where the bowel doesn't work properly and has increased sensitivity and pain, most often in the left lower area of the abdomen. There can be decreased gut contractions that cause constipation, called IBS-C, or increased contractions causing diarrhea, called IBS-D. In this circumstance, the diarrhea is usually brief and a mucus coating is often observed. Initially, the symptoms are minimal, but each new problem slowly adds to the next until your symptoms overflow, limiting your quality of life. This may take years to fully develop, and you might not recognize the beginning phases because the surface of the digestive tract has no pain receptors to let you know what troubles are on the way, and because some of the symptoms you have don't seem to be related to the gut at all. Medication may temporarily decrease your symptoms, but your underlying condition is not improved in any way and will probably result in decreased absorption of vital nutrients, leading to new problems and worsening your old ones. I'll list some of the causes of IBS here and then go into each one more thoroughly in other videos. Cause number 1, bacterial imbalance. This is when bad bacteria overcome the good bacteria. Cause number 2, SIBO, or small intestinal bacterial overgrowth. Here the bacteria move into the small intestine where they shouldn't be. Cause number 3, the gut-brain axis. Studies have found that activities in certain areas of the brain are related to IBS. Cause number 4, H. pylori infection. This is a bacterial infection of the stomach and upper small intestine causing ulcers and changes in the stomach acid. Cause number 5, alcohol consumption. Alcohol is a strong GI irritant and can increase the inflammation of the gut. Cause number 6, stress. This increases stomach acid production, which then leads to increased digestive enzymes and IBS. Cause number 7, slow bowel transit time. This occurs in hypothyroid conditions where the slow movement of bowel causes added irritation and bacterial buildup. Cause number 8, the typical Western diet. This diet is high in processed, refined foods that contain very little digestive enzyme, leading to gut imbalance. Cause number 9, gluten sensitivity or lactose intolerance. This causes an immune response to wheat or dairy and then damages the GI tract and results in inflammation. Cause number 10, increased age. There's evidence that shows that advancing age decreases digestive enzyme production and then increases malabsorption. Number 11, microscopic colitis. This is a variant of inflammatory bowel disease where very small changes in the lining of the intestines results in inflammation and nerve irritation. Cause number 12, food poisoning. Many IBS sufferers show a history of acute gastritis, and chronic IBS can be the result of this event. Cause number 13, Serotonin imbalance. The gut makes 90% of the body's serotonin that is primarily responsible for the movement of the contents of the bowel. Therefore, with less movement, there is more irritation to the gut wall. Now there's good news. By far the most effective approach is much simpler than you think, but it does require a plan. The first thing to consider is that the cause of your IBS is probably not a recent event. It's likely that this has been developing for quite some time, involving several aspects of digestion, but the only way to expect a lasting resolution is to determine the actual cause. And we get to this cause by testing, but not guessing. Testing the gut is now a reliable and non-invasive way to scientifically direct our approach so that we don't have to waste time hunting for the right combination of supplementation, diet change, and lifestyle modification. I'll go over the testing options in other videos, but you should know that it's not only possible, but probable that with proper treatment, the gut environment begins to improve, the inflammation in the walls of the gut decreases, leading to an improved immune picture, better nutrient absorption, and normal function. And when this happens, the other extra-intestinal symptoms like headache, brain fog, skin reactions decrease as well. If you're interested in other information about natural ways to solve your IBS problem, please visit our site and subscribe to make sure that you're getting all the updates and new videos as they come online. And if you'd like to work with me personally, you can let me know there too, so that we can get that set up as soon as possible. Health is on the way.